Hello everyone, good morning all. Myself Dr. Antagiri. Welcome back to my channel Healthy Talks by Dr. Anti and New Sai Apollo Hospital. So boys, after many days, after long back, I'm hearty welcoming you back to my YouTube channel New Sai Apollo Hospital and Healthy Talks by Dr. Anti. So in the last class, almost 8 to 9 months back, we started cardiovascular system. In that we discussed about cardiac cycle, heart sounds, and jugular venous pulse also. So the today topic is the natriuretic hormone. Very important for short notes and very important for objective types questions also. So in the body, in the human physiology, there are two systems actually which control all the functions of all the systems in our body. One is central nervous system and second one is endocrine system. Central nervous system which regulates all the functions of all the systems in our body by sensory, motor, sympathetic, parasympathetic nerve system. At the same time, the endocrine system also regulates all the functions in our body by secreting some chemical messenger which are also called hormones. So not only endocrine organs, some other glands also, some other structures in our body also secrete some hormones like heart, which secretes natriuretic hormone, gastrointestinal system like stomach and small intestine and large intestine secrete some gastrin, somatostatin like hormones, and brain and kidneys also secrete some such type of hormones, specific hormones. So the topic is today the natriuretic hormone. Natriuretic hormones. The name itself indicates natri means sodium. Uretic means excretion. Excretion of the excessive sodium which is present in the body is called natriuretic hormones. These hormones are secreting from the heart, that's why these are also called hormones of the heart. Hormones of the heart. So what are those hormones which are secreting from the heart? Especially there are mainly two hormones which are secreting from the heart are ANP, BNP. ANP means atrial natriuretic hormone. Atrial natriuretic hormone. BNP means B type or brain natriuretic hormone. Brain natriuretic hormone. Instead of this ANP and BNP, there is one more hormone is there that is called CNP, C type natriuretic hormone. From where these hormones are secreted? See here, for example, this is the heart. Right atrium, left atrium, right ventricle, left ventricle. In this both atria and ventricle, there are some secretory granules are present. Some secretory granules are present, both in the atria and ventricle. These secretory granules These are called secretory granules. These secretory granules secretes ANP, BNP and CNP also. Understood? Right. Instead of these three hormones, one more factor is also present which acts as a natriuretic, which increases the natriuresis by inhibiting some enzyme that is called sodium potassium ATPase inhibiting factor. Inhibiting factor. So these all four hormones, mainly the ANP, BNP, act as the natriuretis. Instead of these two hormones, these two factors also perform same functions. So coming to the next one, what is the structure of these hormones? ANP, BNP and CNP. What is the structure? Here ANP is the first hormone. This is the first hormone discovered in the human body, which contains 17 amino acids. 17 amino acids which are binds with disulfide bands. Disulfide bands or disulfide rings between two cysteines. Between two cysteines, it binds by disulfide bands which contains 17 amino acids. But the circulating ANP in the blood contains 28 amino acids. 28 amino acids. And next one is BNP, B type of natriuretic hormone. BNP. This is also called B type or brain natriuretic hormone. This is the second hormone. This is the second hormone discovered in, especially in the Cochrane brain. The Cochrane brain. It's a such type of one animal. In that animal, it is discovered as a second hormone of natriuretic hormone, also present in human brains also. Human brain and heart also. Mainly it present in heart, especially in the ventricle. The circulating B type of natriuretic hormone contains 32 amino acids. 32 amino acids. And last one, CNP, C type of natriuretic hormone, CNP. So this is the third hormone which is discovered especially in kidneys, also in brain, especially in pituitary gland. And also in vascular endothelial capillaries. Vascular endothelial capillaries, this C type of natriuretic hormone is present. The circulating CNP contains 22 amino acids. 22 amino acids. So this is about the structure of ANP, BNP and CNP. Then what are the main functions of the natriuretic hormone? The name itself, describing that natriuresis means excessive amount of sodium is excreted by the kidney. That is the main function of the natriuretic hormone. Right? So, what is the main function? The main functions of the natriuretic hormone. Here, the main function, the natriuresis means excretion of the sodium, excessive amount of the sodium, right? For example, if there is increasing in the sodium chloride levels in the body, or increasing in the blood volume, or if there is increasing in the blood pressure, these three factors may cause stretching of both atria and ventricles. Causes release of ANP and BNP. Due to the increasing in the sodium chloride levels in the body, or increasing in the blood volume, or increasing in the blood pressure, which leads to increased venous return. When the blood volume is increased, then the venous return also increases to the heart, which leads to stretching, contraction of the both atria and ventricle, may cause initiation of the stimulation of the secretory granules of the both atria and ventricle, which secretes atrial natriuretic peptide hormone and brain natriuretic peptide hormone. Right? The main lead by acting on kidneys, it increases the sodium excretion. By acting on the kidney, it increases the sodium excretion. And by acting on afferent arterioles, where the afferent arterioles are present? In the nephron. In the glomerulus, it has both afferent and efferent arterioles. Due to the dilatation of the afferent arterioles, causes increasing in the GFR. Increasing in the GFR, in turn it leads to decreasing in the blood volume and blood pressure also. Blood volume and blood pressure. By acting on renal tubules, it inhibits the sodium reabsorption from the renal tubules. It inhibits sodium reabsorption. So these are the main functions. By acting on the kidney, it increases the sodium excretion. By dilatation of the afferent arterioles, it causes increasing in the GFR, which leads to decreasing in the blood volume and blood pressure. By acting on the renal tubules, it inhibits the sodium reabsorption into the body. And also due to the increasing in the vascular permeability. Increasing in the vascular permeability. the more amount of blood, extravasation of the blood, extravasation of fluid into the tissues may also leads to decreasing in the blood volume. So these are the main functions of the natriuretic hormone, ANP, BNP and CNP. So then what is the secretion? What is the stimulant for the secretion of this hormone? And then what is the metabolism of this hormone? We will let you know. What is the secretion and metabolism? The main function of the natriuresis, the name itself it indicates excessive sodium from the body is excreted through the kidneys. That is called natriuresis, natriuretic function. What is the secretions? The secretion and metabolism. Just now I explained that when there is increasing in the sodium chloride levels in the body, or when there is increasing in the blood pressure, or when there is increasing in the blood volume, or increasing in the extracellular fluid volume. These three factors increases the stretching of both atria and ventricle, releases ANP and BNP. Larger amount of ANP is from the atria and larger amount of BNP from the ventricles are released from the heart. And sometimes immersion of the neck, immersion of neck into the water. What happens when the immersion of neck into the water? It leads to, it increases the central venous pressure. In turn, it increases blood pressure. Again, it causes stretching of the both atria and ventricle. It releases ANP and especially BNP. Here, the ventricles are stretched. The larger amount of BNP is released. Right? So these are the factors mainly when there is increasing in the sodium chloride or increasing in the blood volume or extracellular fluid or blood pressure or immersion of neck into the water may stretches the atria and ventricles in the heart, when in turn it causes secretion of both ANP and BNP. Here, what is the fate of the ANP? Here the ANP hormone has a shortest half-life. Here ANP has a very shortest half-life. Atrial natriuretic peptide has a very shortest half-life. Which is metabolized by neutral endopeptidase. This is called neutral endopeptidase enzyme. The atrial natriuretic peptide hormone is metabolized by which having very shortest half life is metabolized by neutral endopeptidase. Here this hormone is inhibited by one factor that is called thiorephon. Thiorephon. In clinical practice, the administration of the thiorephon increases the levels of ANP in the blood. The administration of Theorphan may increases the serum levels of ANP. Here, in the heart failure also, the serum levels of atrial natriuretic peptide and B, brain natriuretic peptide or B-type natriuretic peptide are increased in the blood in the heart failure. That's why the serum levels of both ANP and BNP also sometimes used as for the diagnosis of the heart failure. Right? So these are all the ANP, BNP and CNP. And last thing, there is one more factor in the beginning of this class we discussed about one more factor is present in the blood that is called sodium potassium ATPase inhibiting factor. What is that? Sodium potassium ATPase inhibiting factor. This factor which is present in the blood, sodium potassium ATPase inhibiting factor. This is also one more factor which is present in the blood, acts like a natriuresis, uretic function. Natriuretic function, same like ANP, BNP and CNP. Here it increases the natriuresis by, it increases the natriuresis by inhibiting what enzyme? Inhibiting the name itself, sodium potassium ATPase inhibiting factor, which inhibits the sodium potassium ATPase enzyme. Sodium potassium ATPase enzyme. By inhibiting this enzyme, it increases the natriuresis. It acts as a natriuretic hormone. So boys, this is the topic today. So I hope you understood very well. If you have any doubt, please comment in the comment box. If you like the topic, please subscribe my channel and share it to your friends also. And in the next, every day I am going to uploading one important topic every day. And please keep watching my channel, Healthy Talks by Dr. Anti and New Sai Apollo Hospital. Myself, Dr. Antagiri. Have a great day. Thank you all.